Colon cancer is a tumor or a growth of the large intestines, which are part of the digestive tract. And when the cancer starts, we have abnormal multiplication of cells, and these cells will eventually form a tumor or a mass that can cause blockage to the intestines, or it can cause pain. Colon cancer symptoms take time. In fact, many patients, if you ask them, they will tell you, yeah, I've had constipation, sometimes diarrhea, bloating, stomach upset for some time, even a year, before they are diagnosed to have cancer. So if you will encourage people that if you have what we call altered bowel movement, like your normal stool habit is something has changed, even the color of your stool, or you are getting constipated, alternating with diarrhea, gas in the stomach, is good to check that for screening for colon cancer. In early stage, there will be those symptoms we've mentioned, but with the advancing stage, you will come with total blockage. You are unable to pass stool, so we call it intestinal obstruction. Patients can also have weight loss, lack of appetite, tiredness, and if there's bleeding, then the patient becomes anemic. If you have a family history of cancer, there's a chance one can get colon cancer. The other risk factor is a lot of processed meats. Excessive use of fat is not good. Lack of exercise can also contribute, and use of tobacco and alcohol. The primary treatment usually is operation or surgery to remove the tumor. And that is possible especially in early stage. In late stage, then when the cancer has spread, the patient is advised to get chemotherapy and radiotherapy depending on the location of the tumor. And there's a lot of research that is going into colon cancer, and we have a lot of targeted therapy and promising targeted treatments that are in the horizon. They are just under research. In terms of palliative care, patients are encouraged to go through it. It doesn't mean you are dying tomorrow. It's not equivalent to end of life care. Palliative care can cut across, and it involves many things, and one should not shy away. In fact, palliative care, if started early, improves the quality of life of the patient. For colon cancer, one is the history. Physical examination is good to go through a doctor. And then for the testing, it's a planned test. So we can take your stool and just check for what we call occult blood. If that test is positive, then the doctor will tell you you need to go for endoscopy, whereby they look inside the colon with a camera, or colonoscopy. Beyond that, then the doctor can escalate the test to CT scan, MRI, X-ray, depending on their findings. Majority of the patients are actually above 40 years, but we still do have younger patients getting colon cancer, especially if it is like maybe genetic, you inherit some bad genes, and for strange reason they undergo mutation and the cancer starts forming. Excessive use of canned meat, red meat, all those should be used to moderation. But there are those genetic things that we cannot do anything about. As we grow older also, we are at risk of getting any cancer, whether it's colon or anywhere else. There are a lot of myths and misconceptions out there, but at the end of the day, one needs to stay healthy, to have a strong immunity to fight the cancer itself. So a balanced diet comes into play. So you don't have to fly to overseas or India for a surgical procedure. Chemotherapy can be done in the county, so you don't have to fly. And the drugs actually we are importing from India. In fact, Kenya is the biggest importer of cancer medicine from India. So these drugs we are getting from there. So they can still get the same drugs back home and at the comfort of their home country with the family support, But there are few cancers that cannot be managed locally, and we'll tell the patient. As a nation, we need to come together and talk to people through media, through churches, schools. Let them be aware of the common types of cancer. What are the symptoms? how can you get treatment if you have it? And if you don't have cancer, what are the preventive measures you can do? Simple little things. For example, avoiding use of tobacco, alcohol. It can reduce your chances of getting cancer. Immunizing our children against HPV vaccine, HPV virus, by using HPV vaccination can help the young girls in future when they grow to or adulthood, they don't get cervical cancer. Hepatitis B can be given in the community level in the spirit of fighting cancer. People should reduce the use of mirror, okay, because mirror has been linked to throat cancer or esophagus cancer. Exercising, trying to walk, trying to keep healthy, it is good. Because in Kenya, if we look at the big killers, actually number one are the infections, general infections, malaria, typhoid, HIV, pneumonias, and so on. This is followed by heart diseases. So we need to check out, do we have blood pressure? Just go for checking of blood pressure, because that could save your life, because blood pressure is the second killer. Then cancer is like the third. So we need to be aware of all these things. When you go to hospital, don't just go for cancer screening, go for checking of your pressure, your blood sugar, And with all this, we'll have a healthy Kenya, healthy community, and we will be able to build our country to the next level.